Hello and welcome to the HMIS Data Standards webinar. Today we're mostly going to focus on the changes due to the data standards in ServicePoint. I won't go into in-depth on every single question, and we will focus mostly on universal questions. If you have specific funding such as PATH or VA or runaway homeless youth, I can't go over those questions today. We would be here for hours, but please contact the help desk and we will set up some training for those types of projects. I want to start off with some terminology changes, so let me get my PowerPoint going. Okay, thank you for your patience. Terminology changes. We're used to calling everything a program, but HUD has redefined the definition of program to be one of the federal funding sources, such as the HUD COC, PATH, VA, SSVF, etc. It's now a project that refers to the distinct unit of the organization, which may or may not be funded by HUD or one of those other federal partners, but they provide services or lodging within the COC. So I just want to be clear about that terminology change. Next, I want to talk about veteran status. The collection point for veteran status has been changed from project entry to client record creation, and this will enable the response to carry forward from project to project, just like the client's name or social security number. It must be collected on all adults. However, remember, if you have a client that turns 18 while they're in your project, you must go back and update that answer. And don't worry that you need to update all your current clients in the system for this new location. Bowman has told us that they will provide a script that will populate the most recent answer in this new location. All right, next is relationship to head of household. This is a new universal data element, and it is collected on all clients, which means adults and children. This is not associated with the household tab or creating a household. There's no changes to that process. This is just a new question on the universal data elements assessment. And I will go into this in more depth when we go and look at the database. Next is client location. This is another new universal data element. It is only collected on the head of household. What this means is it's a HUD-assigned COC code. It's not going to apply to us, but let me explain why. The purpose behind this data collection element is so for HMIS projects that have more than one COC using their database. But in the state of Arizona, all of our 3 COCs have their own separate and distinct database. And so we don't have to, differentiate which COC the client is coming from. So what we will do is we'll have one option available to you for this question. You must answer it, but there will only be one option. So for users in Maricopa County, that will be AZ 502, and for users in the balance of state, it will be AZ 500. Okay, length of time on street, emergency shelter, or safe haven. As you can probably tell by this wording, this is how we're going to determine chronic homelessness. The answers are similar to the old question, extent of homelessness, but obviously in much more detail. You only need to collect it on head of households and adults. And I will go into more detail about how to answer these questions when we actually get into the database. Okay, housing status. Housing status used to be a universal data element that everyone answered, but that has changed. It is now a program data element that is only collected at entry, and it's only collected by PATH, HOPWA, or RHSA funded programs. RHSA is a rural program. So for those 3 types of projects, you would collect this data on the head of household and any other adult. And the pick list options have changed along with the definitions of them. And so if you are one of those projects above, then please contact the help desk for some additional training from us on how to answer this question now. All right. Health insurance. This is a new program data element. It must be collected on all clients, which means adults and children. And I will explain in more depth how to do that when we go into the database. The HUD verification. Now this isn't necessarily a new data element. This is actually a new software interface that will assist users in meeting HUD's new instructions. And what those instructions basically say are, if you're collecting data through a client interview, they want you to ask whether the client has that income or that benefit for each of the sources listed, rather than just asking them to state, okay, what source of income do you have? You actually say each source and ask them to answer, yes, I get that, or no, I don't. And I will go into that in more depth when we do the presentation from the actual database. All right, here is some kind of specialty questions that I'm just going to go over briefly. Residential move-in date only applies to rapid rehousing projects. It must be collected on all clients. That means adults and children. And it's basically saying once the client moves into their apartment, verify, yes, they've moved in and what is the date that they actually moved in. Then there is the housing assessment at exit. And this is only required of homeless prevention projects at exit, but again, it must be collected for all clients, adults, and children. The next one is housing assessment disposition. This is a new program element collected on the head of household only, and it only applies to coordinated assessment projects. So basically, once you assist someone and you're going to refer them out, where did you refer them to, or did they decline services? And finally, just some other noteworthy changes. There's definitely a reduction in the number of data elements that have to be collected on children, such as income and non-cash, but please keep in mind if your client does turn 18 while in your project, you need to go back and update all those answers for that now adult client. Destination is now a universal data element, and there are some more options on the pick list. Residence prior to project entry has some more options on the pick list. Client name now has a name data quality field. And our community voted to keep some of the non-HUD required data elements because we use them a lot in reporting. So for instance, we kept homelessness primary reason, zip code of last permanent address, and highest level of education. And if for balance of state users, we kept a few additional education questions as well, but nothing different than what you're already used to answering. Okay, let's go to the database and actually do some hands-on training now. All right, so let's get into the database. I'm on my test agency, and I'm going to go through the process of an intake and show you these new data elements and hopefully answer most of your questions. So we would pull up a client. And here's your name data quality field. So it asks things like full name reported, partial, street name, code name. Here's another new feature. There's no more don't know, refuse. Everything is worded client doesn't know, client refused. If it's just that the interviewer did not ask the question, then you choose data not collected. Use their social security number if you have it for search purposes. And again, the social security number data field, there is no longer an option that says don't know, don't have. There's client doesn't know, client refused. And search. Then I'm going to add a new client. And I'm going to show you right here on the client profile screen the client record and where you're going to update U.S. military veteran. This used to be where you could fix the spelling of their name or include their social security number if you didn't collect it at entry. This is also now where you will collect, are they a U.S. military veteran? So in order to do this, you would just click the pencil next to client record and answer the question, yes, no, client doesn't know, client refused, or data not collected if you did not ask them. And save. Simple as that. Now let's go into the entry and look at the other questions. This is simplified for training today, so don't be surprised if when you go to actually enter clients in the live database that your steps are slightly different. The first section of the assessment is the universal data elements, so things like date of birth, the date of birth types, primary race, ethnicity, gender. There's a slight change to gender. It's instead of transgendered, it's now transgender. And there is an other category, so if they identify as something not listed here, you can use other and type in the other gender, but please use this sparingly. I'm going to change this back to female. Do you have a disability of long duration? Yes or no. Residence prior to project entry. This used to be prior living situation. There are a few new options. They added in long-term care facility or nursing home. They added client with a GPD tip subsidy, that's VA. And they added in a residential project or halfway house with no homeless criteria. I'm going to put emergency shelter. If you chose other, they want you to type in the other type of residence. That should be used very rarely, however, because this is a very comprehensive list and almost everything you can imagine would be incorporated here. Length of stay in this previous place. Zip code of last permanent address. So like I mentioned before, this is one of those data elements that our community voted to keep. And so you would put their last permanent address here. Permanent address means with 90 days or more. It is best practice to get their actual zip code, but if for some reason you cannot get it from them or they do not remember it, you are welcome to use any zip code from the area they are coming from. For instance, like if they're coming from Phoenix, use any Phoenix zip code, or if they're coming from Flagstaff, use any Flagstaff zip code. We try to make this as easy for you as possible, so if you hover on the question, zip code of last permanent address, we will provide a cheat sheet for you. For Maricopa COC, this will have the major cities in Maricopa County, and then something to use if they're out of state. For balance of state, we will have all of the counties listed here. Relationship to head of household. Remember, this is required for adults and children. So I'm going to answer self. The options are self, because you're the head of household. You're the head of household's child. You're the spouse or partner. You're some other relation, or you're a non-relation. Client location, you will only have one choice, depending on which COC you're operating in. Homelessness primary reason is another one of those options the community voted to keep, so you are used to answering this question. And then we get into length of time on street in an emergency shelter or a safe haven. So remember the definition of chronic homeless is they have to have a disability, they have to be coming from street, emergency shelter, or safe haven, and they have to be homeless for a certain extended amount of time. And this is much more detailed now, so I'm going to go through each of these questions and hopefully you will understand by the end. The first question is continuously homeless for at least 1 year. So have they been homeless for 1 year or even longer? Yes or no? The next question is, number of times the client has been homeless in the past 3 years. So how many times? 1 time, 2 times, 4 or more. If you say, for instance, twice, then the next question, which starts out if 4 or more, you don't have to answer because you said 2. If, however, your answer was 4 or more times in the past 3 years, then you have to answer this second question, which says if it's 4 or more, total number of months homeless in the past 3 years. So how many months have they been homeless? 1 through 12, or more than 12 months, or more than 1 year. And finally, it wants you to calculate the total number of months that the client has been continuously, not accumulated like up here, but continuously homeless immediately prior to the project entry. And then finally, has their homelessness status been documented? Clear as mud, right? That is the end of the universal data elements. Those are all the universal data elements that are required. If you're an emergency shelter or some sort of drop-in center, this is all that you are required to do. I know that some of those types of agencies go on and answer more questions, and of course the rest of us are required to answer the program data elements, which I will talk about now. The first element is your income source, which you're used to seeing first. There are some changes, however. First of all, they want you to put in the total monthly income. And this is for clients that are receiving more than one income source. So for instance, say you have a woman who is getting, a couple $100s in child support, but she also has a part-time job. So she would have 2 sources of income with 2 different amounts. They want you to add those amounts together and put them in the total monthly income. So I'm just going to make up a number. So, do they receive income from any source, yes or no? I'm going to say yes. And then you can add in the incomes in the same way that you're used to. But there is this new button, which I talked about in the PowerPoint, called HUD verification. So let's click on it now and look at it. The reason this has been added is because, like I mentioned, HUD wants you to ask each source. So they want you to say, are you receiving alimony or some other kind of spousal support? Are you receiving child support, etc., etc., instead of just saying, do you get income? Where do you get it from? So you have to answer each of these questions as yes, no, data not collected means you did not ask them the question, and incomplete means nothing has been chosen here. So I'm going to say they're not getting alimony, but she was getting child support. So as soon as I click yes, it opens up my actual sub-assessment so I can answer the question. So I'm going to say she gets $200 in child support, and receiving income source is yes automatically. This is a new question for some of you. Click Save. Then the next one is earned income. Yes or no? Well, I said yes. She also has a part-time job. So I'll put in her earned income amount, and it is yes. For the rest of these, I asked each one, and for each one, the client said, no, I am not receiving that source of income right now. Save and exit. And then what happens is for every source of income that you ask the client about, it does populate. And I know this looks a little busy and it will be an adjustment for us. However, I did make it available on the preview pane about whether they actually receive that source of income or not. So for instance, if you ask someone, do you receive workers' compensation, and they say no, it says no right here. To see what they actually receive, you would click, maybe you have to next over to the other page, and you would find it until it said, yes, they do receive this source of income, and then you can see the amount they receive. Let's go on to non-cash benefits. So I'm going to say yes, they receive non-cash benefits, and I'm going to use the HUD verification click. And you have your options here. So let's say they're receiving food stamps. I just say yes. The box doesn't open because you don't have to record an amount for these types of benefits. However, if you say that they are not receiving something, so let's say I'm saying they do not receive Medicare. Okay, it worked that time. So no S-chip, no WIC, no VA, etc., etc. And save and exit. Same idea, you've asked them about everything, they've said no. If they say yes, you can see it in the receiving benefit preview pane. Now we'll go to health insurance. I'll say yes, they're covered by health insurance because up here I did say Medicaid. I'm not sure if we're going to remove these from this pick list or not. I need to ask Bowman, but we'll make a decision about that soon. So again, I'm going to HUD verify it, and I'm going to say, are they receiving Medicaid? And I said yes up here, so I'm going to say yes again. Are they receiving Medicare? No. Now, every time you say no to health insurance, you will get the pop-up, and the reason for this is for HOPWA. If you are a HOPWA-funded project and you say no, they're not getting something, you have to answer why they're not getting it. And so this is why it pops up. But if you're not HOPWA-funded, you just click Save, and you're good to move on to the next one. So, for instance, they're not getting state health insurance, save. They're not getting VA benefits, save. Make sense? So you could go through each one, asking them whether they get these items, see employer paid or through COBRA or private pay, until everything is answered, and save and exit. And again, I gave you this little cheat where it says covered. Yes means they are. No means you ask them and they do not receive that benefit. And finally, we have disabilities, and I'm not going to use the HUD verification this time, just so we can get moving along in the training. I'm just going to show you one because there are a couple additional questions. So I'm going to add a disability type because I said they were disabled. And you're used to determination, yes or no, but then there's a couple new questions. The first one is, if you said yes, is it expected to be of long, continued, and indefinite duration, and it substantially impairs their ability to live independently? Yes or no? If yes, is documentation of their disability and its severity on file? The next two questions only apply to PATH teams, so you can skip them. And just go down to, if yes, are they currently receiving services or treatment, and is it the condition going to be long-term? Save. And again, you could answer all of these through the HUD verification link as well. Finally, we have highest level of education attained. Again, this was a not required by HUD, but a question our community decided to keep. And so you can answer this. And I included the different degree levels on here, so you don't have to do that additional sub-assessment. You just choose literally the highest level of education they've attained. And if you're a balance of state employee, there are a couple additional education questions, but it's nothing that you're not used to looking at. Domestic violence victim or survivor, yes or no? And if you say yes, you must answer the extent. And that is the end of the program required data elements. Now, like I mentioned before, if you're funded by another federal partner, such as SSVF or HOPWA or PATH, then you do have additional questions to answer. And I would encourage you to contact the help desk for assistance with that. Now let's go back to the PowerPoint and wrap things up. So, in order to receive credit for watching this webinar today on the new data standards, we are going to require that you take a quiz through SurveyMonkey, just so we can verify that you watched the webinar and you retained the information by answering a few quiz questions. So the address or the link to the SurveyMonkey quiz is below. In case you don't have time to write this down while I'm talking, you can always contact us at the help desk phone number or email, and we will send it to you. I also just want to let you know about some resources available to you. If you would like a copy of this PowerPoint, just let us know. I will email it to you. We're going to provide you with a reference sheet if you request it, and I'll show you that sheet in a minute. And I can also provide you with a link to the actual HUD data manual. Here's a quick look at the reference sheet I am talking about. So this is a HUD, HMIS Universal Program Data Elements. This is just a basic generic one, but we've actually created one for each project type. But for instance, it will tell you all the different data elements that are required to be collected. It lets you know by these little codes, H, A, or C, are you required to collect it for only the head of household, for households and adults, or for children as well. And then the little page numbers tell you where that information is in the Data Standards Manual. So if you're interested in these little cheat sheets, just let us know and we can email them to you. And I will wrap up by saying thank you so much for listening and participating in our webinar. Go take your quiz while everything is fresh in your mind, and don't hesitate to contact us with any questions. Thank you.